Greetings to you, Rotary family, and happy fall. As we watch the leaves fall and the seasons change, we share this opportunity to appreciate and celebrate how we are changing lives every day through the work of our Rotary Foundation. November is Rotary Foundation Month. Last Rotary year, we raised over $560 million for our Rotary Foundation. But more importantly is the impact that we are having through those gifts, the generosity of our members, you and your fellow club members. What is it that we're doing? We're eradicating polio. Through district grants, we're supporting local food pantries and victims of domestic violence. We're building peace by creating awareness and investing in our Peace Fellows through our Peace Studies programs all over the world. Through our Disaster Response Fund, we've been able to assist victims of war and natural disasters. Our programs of scale, providing us the opportunity for larger sustainable programs, like where we partnered in a malaria-free Zambia. And yes, through our global grants, we focus on large programs that improve lives. I hope you enjoyed this interview with Regional Rotary Foundation Coordinator Joanne Ventura and Steve Jambor on saving mothers and children in Uganda, involving the impressive collaboration of clubs and districts from all over the world. Thank you, Steve, for sharing your story and inviting all of us to participate.
November is Foundation Month, and today I'm pleased to introduce you to Steve Jambor of the Rotary Club of Wilmette, Illinois. He is going to tell us about an amazing international multi-global grant initiative, Saving Mothers and Newborns in Uganda. Steve has a passion for developing medical technology and a commitment to serving others by bringing medical projects to underserved areas around the world. Welcome, Steve. Can you tell me how this project came about?
Well, the current project that we're working on is empowering families and growing futures. And it's in Uganda. And we've been communicating with the leadership there, the district leadership, on several fronts. I worked on a project with ultrasound, and a colleague of mine worked on a project focused on training midwives. And we joined forces and put together a project back in 23 where we were able to really get measurable results. And that was the precursor to filing for a program of scale in 2024 and 2025. Unfortunately, those weren't successful. And so we've now pivoted to a new global grant. And we're happy to say that phase one of that grant is been submitted and all the authorizations signed off on. And we're just waiting for TRF to move forward with the grant as it is.
Thank you. And who will benefit from these projects?
Well, I'm glad you asked. The primary beneficiaries are all the midwives, nurses, and allied medical staff at the health center threes and fours that are getting trained. And we have a comprehensive training program that brings up their skills and gives them the confidence to provide safer births for hundreds, if not thousands, of mothers and newborns that will have safer births because of it. For example, in the original grant back in 2024, we supported over, I think it was 200,000 births, or no, 200,000 mothers and child, so about 100,000 births. And that's an annual improvement. And the statistics that really shine through are just the number of resuscitated newborns that we had. Our increase over the grant period was 58%, which far exceeded any of the other health centers in the area, the peer group. And that's one of the reasons why the Ministry of Health is so interested in our program. Um, and we also saw an increase in people coming to the facility with more births, like 14% increase in births, and also the women coming for the antenatal care with 4+ visits, that was an increase of 28%.
You've said that this is a quite large scale grant. How many districts are currently working with you on this project?
So the total value of the phase one was $550,000. And a lot of that came from DDF, both from districts here in Chicago area, so 6450. And we also had some support from Canada in the Calgary area. And the greatest support was through, obviously, we had Uganda support and Taiwan, big participants in that area. And so we were very grateful for that, and also included Singapore. So a lot of different backgrounds supporting this great initiative.
Thank you. So you discussed phase one. I understand there's also a phase two.
We're working on currently a phase two, and the global grant is 2687144. And it's a phase two, which is going to support additional health centers in the districts that we're serving. So far, we're pivoting around 14 districts, and but they're all hand selected by the leadership in Uganda. And it's a very interesting profile that the clubs are getting together in creating cohorts, and those cohorts will service one or two districts. And within those cohorts, we're developing Rotary Community Corps, which are additional volunteers that will service the community and help generate demand at the health centers that we're improving. So it's a twofold project that we're creating the demand for the health services and also improving those health services at the government facilities.
Well, that sounds really great. We all know that the foundation is requiring that districts expend their unused DDF within 5 years. Can any of our districts participate with you in this phase two project?
That would be absolutely wonderful. And we have created the global grant, so it's a valid number. We just need participants to come out. If anybody wants additional information, I can send them a what we call a project statement, and basically it outlines the parameters that the global grant will follow.
That's great, Steve. Send that to me as well. And
Okay.
people are free to contact me through our website or you directly, and I'll have that information ready to be available for anyone who is interested.
Yeah,
So
that
thank,
would be fantastic. Yeah. So
thank-
we're hoping that the second phase will be about the size of the first one, and we're looking to fulfill that within the next 6 months.
Steve, thank you for sharing our the ability to participate in this wonderful project. I look forward to working with you and your districts in the future.
Excellent. Thank you so much.
Thank you very much, Steve.